Hello everyone, welcome to the new session in the series of medical education, that is teaching clinical skills. Myself Dr. Tushar Kalra, MD Community Medicine. Let's begin our session. Our specific learning objectives are to learn about the various model of teaching clinical skills to the students and to apply the knowledge in day-to-day teaching. Now what is a skill? A skill implies something which is in psychomotor domain and mainly focuses on procedural skills. Now what is a clinical skill? Clinical skill is taken as any action performed by the physician which has a bearing on the patient outcome. Now there are various models to teach clinical skill to the student. First is observer model. ये सबसे oldest and most commonly used model है. It implies that teacher interact with the patient and the student observes the interaction, picking up the skill in due course. इसमें basically बहुत simple है. Teacher interact करेंगे patient के साथ में and student will observe the interaction and will learn by themselves. Then there is a direct responsibility model. It is basically a role reversal. Student interact with the patient and teacher observes the interaction, providing them feedback and counseling later. Then not all students may be ready or willing to take up the challenge, so we have to motivate the student to take up this challenge, interact with the patients more regularly and more often. So it is difficult to implement in a busy situation. For example, our mini clinical evaluation exercise is based on direct responsibility model. Now next is staged approach, that is Peyton approach. इसमें क्या आता है? इसमें basically 5 steps हैं. Peyton's approach में 4 steps हैं. Modified Peyton's is the 5th step, that is added extra. So first is demonstration of skill with no explanation. We have to repetition of the skill or demonstration with explanation and encouraging the student to ask question. Then in third step, the teacher perform the skills for the third time with the student describing each step. And in the fourth step, student perform the skill under supervision, explaining each step before it is performed. So basically 4 steps है. पहले demonstration, teacher demonstrate करेंगे with no explanation. Then second, repetition of the skill, demonstration with explanation and encouraging the student to ask question. Third step में क्या होगा? Teacher perform करेंगे skill, student explain करेंगे each step. Fourth में student perform करेंगे skill को under supervision, explaining each step before it is performed. Then there is a fifth step, that is modified Peyton's approach. इसमें क्या होगा? Student अपने peers को skill सिखाएंगे with the following the above 4 steps in the same sequence, that is modified Peyton's approach. Then there is another model, that is 1 minute preceptor model. It is based on the principle that in the last 1 minute, real teaching takes place. It takes relatively lesser time and best suited for places with high workload. So there are 5 micro skills that are required. That is, get a commitment, look for supporting evidences. We have to reinforce what is right. We have to correct mistakes of the student, and we have to teach the general rules at the last. Then there are skill laboratories and simulations. So skill laboratories, they provide a protected environment for learners to practice clinical skills before using them in a real setting. So skill laboratories, they teach technical skills as well as non-technical skills such as communications are taught in these laboratories. Now talking about simulation, so there are simulated patients that we use. It is a healthy actor who has been trained to display different clinical signs and symptoms. And standardized patient is a real patient who has the history and clinical finding of a medical problem. So these are simulated patients or standardized patients that we use in the teaching clinical skills. My references for these slides are Principle of Medical Education, 5th edition by Dr. Tejendra Singh. Thank you everyone. Like, share and subscribe to my channel.